Good evening, everyone. My name is Walid Tawfiq. I am orthopedic surgeon in Yeovil District Hospital. Today, another episode of problem-solving practice for FRCS trauma and orth, adult pathology section. As a reminder, how to get the maximum benefit from this video. At least two candidates should be practicing to give feedback to each other. See the image or listen to the scenario. Pause the video after each question, answer the question, try to start abroad. Use the algorithm used in previous videos. The next question will provide you with more information to direct you to the diagnosis and treatment for this specific case. The feedback should be written to simulate the exam feedback as possible. Let's go. Case 1. 22 years old, keen footballer, fell during a tackle, attended to ED, isolated injury. Describe what you see. What are the important points in history you need to know? How to examine this patient? How to reduce that dislocation in ED? What is the post-reduction protocol? What are further investigations you might need? How to counsel this patient as regards the operative versus non-operative treatment? What are the guidelines you follow for managing this patient? Treatment received. ED management done first. As this patient had a recurrent dislocation, he had an arthroscopic puncture to repair. Case 2. 44 years old, speak little English, head-on collision, RTC, passenger seat, isolated injury. She had a numbness in the axillary nerve distribution. Describe what you see. What are the important points in history you need to know? How to examine this patient? You did a trial of reduction in ED, but you didn't manage to do that. What's the next step? You took the patient to theater. You managed to reduce it. What is the post-operative follow-up plan? What are the guidelines you follow for managing this patient axillary nerve injury? Treatment received. Patient had reduction in theater. Stability confirmed under II. She had a follow-up for 3 weeks with weekly X-ray on arrival. Doesn't show any displacement of the tube positive fragment. Her axillary nerve symptom resolved after 6 weeks. Case 3. 94, retired secondary school teacher. She is still driving, independent. She had a slip in the bathroom. She had no post-medical history. Describe what you see. What are the important points in history you need to know? How to examine this patient? Trial of reduction in ED fail under appropriate analgesia with safe environment. You managed to do that in theater. However, the patient had a redislocation in recovery. What should be the next step? You get a CT scan. What is your treatment plan then? Treatment received. Patient had an open stabilization of the tuberosity fragment and repair of the cuff. Case 4. 75 years old, keen runner. He had a fall more than 24 hours ago on his left shoulder. ED trial of reduction failed. Had a background of hypertension on a single medication. Describe what you see. What are the important points in history you need to know? How to examine this patient? You managed to reduce in theater. However, patient had a redislocation while he's ready to go home. What would you do? You had this CT scan. and you discuss with one of your upper limb colleagues. Describe what you see and what's the treatment plan. Treatment received. Patient had another episode for theater, had MUA, closed reduction achieved, very unstable shoulder. He had an arthroscopic assessment which showed extensive rotator cuff tear. He had an open cuff repair, remplissage procedure to fill the Hill-Sachs lesion. Shoulder is still stable 1 year post-operative. Patient is happy. Case 5. 44 years old man, keen glider, had a fallen outstretched hand. He's a smoker, no other past medical history. He had a reduction done in ED. First clinic visit a week later. Shoulder is still reduced, but unable to move the shoulder actively. Describe what you see. What is your concern? What are the important points in history you need to know? How to examine this patient? What are further investigations you will need? You decided to get ultrasound scan. The sonographer wasn't sure about the rotator cuff injury. What is your next investigation of choice? What is the time frame to get that? Patient had an urgent MRI scan. The MRI scan as shown in picture. What's your treatment plan? What's your concerns given the MRI scan appearance? Treatment received. Patient had an open rotator cuff repair through a Mackenzie approach and had a subacromial decompression. Thank you.